Assalamu alaikum student. Today we are going to study about the angiotensin medications and the COVID-19. So several reports which contains detailed the complex relationship between the angiotensin systems and our current coronavirus. A new in-depth analysis for this relationship from collaborate at Harvard, Brigham's and Women hospitals. The University of Minnesota and the University of Glasgow was just published on in the New England Journal of Medications. The bottom lines for the most people on the medications: sit tight and consult your physician. COVID-19 does use the angiotensin converting enzymes to on cell in invite them. So, angiotensin converting enzymes inhibitors and angiotensin receptor blockers increase this substance in the body, and animal studies suggest a risk for COVID infection. However, there is no conclusive human data from the Chinese COVID-19 expression to show thumbs say up and down. These medications are life-saving for those with heart failure, and they should absolutely not consider switching at this time. For those on the drug for blood pressure control, and the decisions to switch up to your doctor. Beginning a new drug requires careful monitoring that may be difficult during those trying healthcare times. So there are some important advice for this. Stopping your medications for high blood pressure and heart failure conditions could be dangerous. It is important to continue taking medications at prescribed your doctor. ARBCs are common medications used to treat heart failure, high blood pressures, and people who have suffered the heart attack. So it was all about the angiotensin medications and COVID-19. Allah Hafiz.